Ever wondered how medicines can control hallucinations, delusions, and severe mood changes? That's exactly what antipsychotics do. And in this video, we are going to understand them step by step. Now, let's dive into the topic. The term antipsychotics. Anti means they act against something, and psychotics means psychotic symptoms here. So, the entire term antipsychotics means the medicines that act against the psychotic symptoms. Now, they're also known as neuroleptics, major tranquilizers, D2 receptor blockers, or commonly known as anti schizophrenic drugs. So, this is very important for the multiple choice questions that you get in the competitive exams or your usual university exams. So, neuroleptics, major tranquilizers, G2 receptor blockers, anti schizophrenic drugs are all the other names or common names of antipsychotic drugs. Now, coming to the classification. So, the antipsychotics are divided into two major classification. However, there has been revision in this and there has been addition of new classifications, but for your knowledge you should know that there are two major classifications of antipsychotic. First is typical antipsychotics or first generation antipsychotics, which are also known as conventional antipsychotics, and the other ones are atypical antipsychotics or second generation antipsychotics. Now, why did we need second generation antipsychotics? Because according to the studies or according to the evidence, it was seen that the side effects associated with typical antipsychotics were very severe, and they were one of the major reasons of medication non-adherence or non-compliance. Now, diving into how antipsychotics actually work or what we call psychopathology. So, for understanding that, you need to understand this dopaminergic pathway. The dopaminergic pathway contains four pathways, which are mesolimbic, mesocortical, nigrostriatal, and tuberoinfundibular. Now, mesolimbic starts from ventral tegmentum and it ends in limbic system. Excess dopaminergic activity in mesolimbic pathway leads to positive symptoms like hallucinations, delusions, illusions, etc. Now, mesocortical pathway, it starts from ventral tegmentum and it ends in the cortex. So diminished. Now, focus on this that in mesolimbic there was excess of dopaminergic activity, but whereas diminished activity in mesocortical pathway leads to negative symptoms like avolition, anhedonia, and etc. Now, coming to the third pathway, which is known as nigrostriatal pathway, it begins from the substantia nigra and it ends at the striatum of basal ganglia. It causes involuntary psychomotor symptoms. And the last is tuberoinfundibular pathway. It starts from the hypothalamus and ends in the pituitary glands. And the disturbance here leads to endocrine abnormalities like galactoria, gynecomastia, etc. Okay. So now from this psychopathology, you understand that whenever there is an increase in the dopaminergic activity in mesolimbic pathway, there will be psychotic symptoms. So what do we need to do? We need to decrease the dopaminergic activity in the mesolimbic pathway so that the psychotic symptoms are not there. But in the mesocortical pathway, we need to increase the dopaminergic activity so that the negative symptoms are abolished or they are not existing. So, this is how the psychotic symptoms and associated symptoms of schizophrenia or psychotic or other disorders actually happen by causing a disturbance in the dopaminergic pathways, which are mesolimbic, mesocortical, nigrostriatal, and tuberoinfundibular. Mesolimbic leads to positive symptoms, mesocortical leads to negative symptom, nigrostriatal leads to psychomotor symptoms, which we will study in detail later on, and tuberoinfundibular leads to endocrine abnormalities. Now coming to the typical antipsychotics. So how do they work? They do decrease the positive symptoms in the mesolimbic pathway because what happens is typical antipsychotics block dopamine receptors throughout the brain. So they are not working selectively. What they do, they are dopaminergic blockers. So they block dopamine, but they block in all the pathways throughout. So what happens now, in mesolimbic pathway, it is a beneficial thing because we wanted to decrease like dopaminergic activity. So the positive symptoms reduced or the psychotic symptoms reduced. But the problem is it also decreases dopaminergic activity in the mesocortical pathway. So one of the major disadvantages, it further increases the negative symptoms like anhedonia, avolition, etc. Now, in the tubuloinfundibular pathway, it causes endocrine abnormalities like galactorrhea, amenorrhea, gynecomastia, etc. And in the nigrostriatal pathway, it leads to psychomotor symptoms, which are known as, kindly note it down, EPS, extrapyramidal symptoms. We will be studying this in detail because it is a very important part or very important chunk from the antipsychotics, and you may expect a question from EPS. Now, some other side effects of the typical antipsychotics or the first generation antipsychotics, or what we call the conventional antipsychotics, are they also block the anticholinergic M1 receptors and hence cause dry mouth, constipation, blurred vision. They also block the H1 receptors, so they cause weight gain, drowsiness. They also block the alpha 1 adrenergic receptors and may cause orthostatic hypotension. So, apart from the problems that were happening due to the blockage of dopamine in the dopaminergic pathways, there are some other side effects associated with the blockage of these receptors. So you're clear with it now. And typical antipsychotics help improve the psychotic symptoms, but it worsens the negative symptoms, and it also has associated side effects like dry mouth, constipation, orthostatic hypotension, weight gain, and drowsiness. So that's where atypical antipsychotics came in the picture. We wanted to do something about all these symptoms, and then atypical antipsychotics came into the picture. So they block dopamine receptors in mesolimbic pathway, but they block serotonin receptors in mesocortical pathway. So what happens this way is, by blocking dopamine receptors in mesolimbic pathway, the positive symptoms are finished, they are abolished. And by blocking serotonin receptors in mesocortical pathway, the negative symptoms also are relieved. So they are also reduced. It simulates dopamine and norepinephrine release in the prefrontal cortex. But the antagonism of M1, H1, and alpha 1 receptors happens with atypical antipsychotics as well. So there will be dry mouth, constipation, orthostatic hypotension, etc. So the benefit here is that the positive symptoms reduce, but the negative symptoms also decrease, unlike typical antipsychotics. But one of the major side effects associated with atypical antipsychotics is that it causes cardiometabolic side effects like increased risk of diabetes, which leads to increased risk of diabetes and increased risk of obesity. So now the final conclusion of this entire topic of antipsychotics. So I've tried my best to summarize the whole topic for you. And now the comparative study of atypical and typical antipsychotics. So first generation antipsychotics and second generation antipsychotics. First, you can divide them or distinguish between them. First thing you can write is the names. So first generation antipsychotics, it is also known as conventional antipsychotics or typical antipsychotic. Second generation antipsychotics is also known as atypical antipsychotics. The second criteria for mechanism of action is D2 antagonism throughout the brain. And for second generation is G2 and 5-HT2, that is serotonergic antagonism. They are effective against positive symptoms, whereas second generation are effective against positive as well as negative symptoms, as we have discussed through the psychopathology. The EPS is more associated with first generation antipsychotics as compared to second generation EPS, which was the psychomotor side effects, extrapyramidal symptoms. And the metabolic side effects, however, are more in the second generation or typical antipsychotics. The use of first generation antipsychotic is in acute management. Usually when a patient comes in the acute stage due to the OPD with severe psychotic symptoms, for the acute and immediate management, we give first generation antipsychotic, but in treatment resistant cases or for long term maintenance, we give second generation antipsychotics because the side effects associated with first generation antipsychotic in long term treatment are too high and it leads to treatment non compliance. So that was all about the topic for today. I hope you understood antipsychotics very easily because that's the easiest way I could have taught you this. I have tried my best to bring the entire topic into just 2 sheets of paper. And if you have any doubts, you can let me know in the comment section. And you can also give me suggestions for what you all want to read or study about in the next topic. I'm planning to teach you about EPS or NMS in the next video. Thank you. Hope you enjoyed the video and you were able to understand the topic. Bye.